Another very most common infection in people with diabetes is tuberculosis. And after 50, 70 years, also we still see, and in public hospitals also. Since you are the head of medicine there, I'm sure you come across a lot of people with diabetes and tuberculosis. So has it increased? Is it the same? And how do we approach this? This is a public health problem.
Very pertinent issue. Maybe 30 years back, the message was if a diabetic presents with fever, you must not leave him without a chest X-ray because tuberculosis was so common association. India has tuberculosis uncontrolled and India has diabetes uncontrolled. Another thing which creeps in is HIV. And HIV tuberculosis is very common, and if a patient is diabetic at the same time immunocompromised, uncontrolled diabetes, because patients of diabetes, controlled and uncontrolled, have different story and different presentation. And those who have a very hazardous lifestyle, uncontrolled diabetes, and continued fever, that you must have a thought that the patient can be tuberculosis, and the workup must contain
a very high antenna and index of
suspicion, and we detect the tuberculosis infections and the fever persisting for more than 2 weeks in almost 60% of the diabetics that are there. And they also require insulin.
Are there any atypical presentation apart from chest? You see extra pulmonary manifestation of tuberculosis?
Very common. Second will be the lymph nodes that we see, mostly cervical and other groups like axillary also. Third is we have seen the cutaneous, we have seen the abdomen, we have seen the genitourinary, even we have seen the musculoskeletal. And atypical tuberculosis mycobacterium is also not uncommon.
Okay.
So many times we go for the liquid culture, we detect tuberculosis, and if we fail from every front, we go for a empirically antitubercular course of treatment, which is highly responded by these people. So starting from the liver tuberculosis to the bone tuberculosis.
Very difficult.
But in the background, if there is diabetes, you have to keep it in your mind. They are the people who respond very well, provided we start along with insulin. Unfortunately, many physicians in the country still try with oral drops.
That's a very important message. So any infection, patient to be on insulin, isn't it?
Yeah, and especially tuberculosis, because the antitubercular drops, they work through the hepatic P450 enzymes. If you give oral drops and the antitubercular drops, you don't expect an optimal response from these drops. So, very important message goes: we have to plan a antitubercular therapy with insulin. Whatever may be the situation, you have to convince the patient. You have to admit the patient for a long time, but insulin along with the antitubercular drops, at least in the intensive phase, is must for the antitubercular drops to work optimally.